Good afternoon, and thank you very much for this opportunity to welcome the Minister publicly to his new ministry and to the Queen Elizabeth Hospital. Ever since the hospital opened its doors in 1964, not for a single day have we ever deserted the people of Barbados in caring for their health needs. We've done that through natural disasters, through mass casualties. Particularly, we have stood by individuals and their families and their health crises, and this COVID pandemic is no different. For almost 2 years, we have stood by the country and evolved and changed as needs be. I am particularly proud that we have not ceased any of our essential services. Certainly, we have had to slow them down and at times pause, but unlike many of our Caribbean countries, we have endeavored successfully to keep our main hospital relatively COVID-free and to maintain our non-COVID services. As you will appreciate, the COVID pandemic means that we have a new category of patient to look after. Those who may be or are affected by the coronavirus to varying degrees. That is primarily the responsibility of the isolation stream of our healthcare system. But because of the Queen Elizabeth Hospital by nature being our major point for the most severely ill to be cared for, we are the repository of the major expertise and equipment for saving lives. We obviously have to bridge the gap between being a non-COVID, non-infectious environment, which is what we try to do for our patients. And we are thankful that the public has largely worked with us in this respect. We know that the visiting restrictions that we have had to impose to try and keep the virus out of our wards has been difficult. But we also know that it has been successful, and we thank you for your cooperation. Our clinics have had to be scaled back through the use of telemedicine and the assistance of our Transitional Community Care Program, which is a new initiative to help the most vulnerable remain in their homes safely. But we know that when people are anxious, especially if they have been told or suspected that they are COVID positive, they will want to come to the hospital. That has been our culture. And the place of first contact is usually the Accident and Emergency Department. Because of the large volume of ill patients, both COVID ill and non-COVID ill coming to our Accident and Emergency Department, we really cannot entertain people who are potentially infectious waiting for long times because of relatively low priority illnesses. So to address that, as you've heard from the Chief Medical Officer, there will be satellite areas for COVID and COVID suspect people who are in isolation or quarantine and who have concerns, so that you can avail yourself of health care there without taking the risk of coming to the Accident and Emergency Department, mingling with people who are potentially very ill and therefore able to spread the virus more than you would want. The new part of this virus, as it has affected us, is that not only are patients affected, but our staff. Like the country, we have had rolling numbers affecting various departments one at a time. So on a daily basis, we have had to shift the focus of providing resources to departments one at a time. Even with this, we have been able to maintain our emergency services and the basic care of the most vulnerable. This is in large part due to our surge planning, and we have to inform you that parts of the surge plan are operational in those departments most affected. So you will see a change in the wait time and the availability of many of the services that you are accustomed to, but they will return as soon as possible, and emergencies and genuine crises will always be taken care of. We ask, if you have any concerns, please to call our help desk 536-4800, where we have qualified health professionals standing by to address concerns without you showing up and taking the risk of being somewhere in person. As always, we are honored to partner with you in the care of your health. While we endeavor to do our part, we ask that you too follow the things that you know, can, and have worked to keep our country safe this far. Hand washing, vaccination and boostering, social distancing, and making informed choices so that you can minimize all the risk factors. We have vulnerable people in our population who depend on us all to look after them. We will work to fulfill our obligations. We thank you for doing yours too.